would you say as a physician? When should women start their mammograms and how often?
So I would say that women should start mammogram at age 40, and they should do it on an annual basis.
Why do you think it's so important? Because I know people say, oh, it's uncomfortable, maybe I'll push it off. Why would you say, don't do that?
We know that mammogram catches cancers at an earlier stage. And most importantly, we know that women who are undergoing mammogram have a decreased mortality rate from breast cancer.
And the rates are changing. From what I'm reading, we're seeing more younger women diagnosed, more Black women diagnosed. Why is that now?
I don't know if we really understand why. We have seen an increased incidence among younger women, and that's been dating back to almost 2004. It's just there was a recent study from 2015 to 2019 showing a more marked increase in younger women. And that's part of the reason why I think the U.S. Preventive Task Force decided to lower their age for when women should start screening mammogram.
What are lifestyle things that women can do, knowing perhaps that there is a greater risk that can offset that risk?
So important lifestyle things, a healthy diet, exercise is important, avoiding lots of alcohol and drinking is important. And I think being sort of what I call risk aware, aware of your family history, aware of your breast density, and you would get your breast density reading through a screening mammogram. Those are all things that are what we call modifiable risk factors.
Okay, let's delve into two of the important things you said right there, the family history and the breast density. Let's start with the genetic risk, because I know people can get genetic testing and they say, oh, I'm not BRCA positive. But that's just one gene, isn't it?
Yes, so we started doing what's called multi-gene panel testing in about 2012, 2014. And now you can get a panel of almost 20 or even up to 80 genes. So there are many more genes that we know about now besides just BRCA1 and 2. So if you have a lot of family history of breast or ovarian cancer, it's important to talk to your provider, your primary care provider, about genetic testing.
Okay, let's talk about dense breasts, because I think a lot of women are confused by that. A lot of women can be concerned by that because sometimes the mammogram comes out a little irregular and they think, oh no. So what are dense breasts, and what does that mean for a woman in terms of her risk of breast cancer?
Dense breast tissue is something seen on a mammogram. A lot of people think it's maybe just by feel, they feel like they have dense breasts. You can only tell if you have dense breasts on a mammogram. And it's the balance between the fatty tissue in the breast and the breast tissue. And there are 4 density readings. The 2 highest readings we call dense. And about 50% of women who come in for a screening mammogram have dense breast tissue. And there are additional what we call supplemental imaging tests that they can undergo that should be added to their mammogram.
Let's talk about the hope, because this show is stories of hope and the survivorship in terms of the women who are diagnosed and the women who survive now.
So we know that the mortality rates in breast cancer have dropped dramatically. I mean, 30% drop over the past 20 to 30 years.
That's significant.
Yes. So we're definitely making inroads. And I would say over the past few years, since the pandemic, there have been a couple real big landmark trials that were published that have really changed the way that we treat certain types of breast cancer and really improved survival rates. So I do think the future is promising.
I think collaboration in pandemic was something that was really profound, and it ended up applying to cancer research post-pandemic. So would you say that there are many more options for women when they're diagnosed in terms of treatment?
Oh, most definitely. We've learned that breast cancer is a very heterogeneous disease. There are aggressive breast cancers, there are less aggressive breast cancers, but we have treatments for all different types of breast cancer, and they're improving every day.